Hi guys. So in today's video, I'll be talking about yeast infection. After watching this video to the end, you as a lady, you cannot decide whether to blame your partner for giving you yeast infection or you blame yourself for allowing yeast infection to grow out of control. Let's find out. Yeast infection is a fungal infection that is caused by an outgrowth of a particular yeast called Candida albicans. It affects the vagina and its surroundings. Candida albicans is part of normal flora. What are normal flora? The body normal flora are a group of microorganisms that don't cause infection. They are not harmful. They don't cause infection. They are in a particular place in our body just so they can prevent other microorganisms that can cause infection from colonizing that same place. They are found on our skin, in our mouth, and even in the vagina. So this Candida albicans is part of them, but it is found in a very small amount. So the outgrowth of this Candida albicans is masked by two factors or two things. Let's say two things. One of it is a particular bacteria called lactobacillus. This lactobacillus maintain or keep the yeast in a balanced medium. This lactobacillus do not allow it to grow out of control. And also the acidic medium of the vagina. The vagina is slightly acidic. So with the acidic medium of the vagina and the bacteria, this yeast cannot grow out of control. But there are factors that can allow this yeast to outgrow. These same factors I'm about to mention are the same factors that are responsible for when someone starts having recurring yeast infection. Number one, persistent use of antibiotics. You know, I said earlier that this yeast infection, the outgrowth is marked by a particular bacteria. So when someone keep using antibiotics, it's going to kill the bacteria they are using it for, obviously. And it's also going to kill the good bacteria in our body, which is the normal flora. So when the lactobacillus, when it is being killed by the antibiotics that the person is using, is going to then allow the growth of yeast infection, the growth of yeast, sorry. Then the yeast will not be like, yes, I'm alive. They will not start growing because there's nothing keeping them from growing again. Also, hormonal imbalance. Normally, for some people, their hormone just change anyhow. When I mean anyhow, their hormone changes when they want to menstruate. After menstruation, any small stress has changed their hormone. So if there is hormonal imbalance or there are factors that changes people's hormone, they will keep having reoccurring yeast infection. Another factor is weak immune system. HIV, stress, and drugs, and some certain drugs actually can reduce immunity. And then when the immune system is weak, yeast will grow. Then another factor is poor vaginal hygiene. A lot of us are overdoing things. Yes, when you overclean vagina, yeast infection will occur. The yeast will grow. Some people even spray the vagina. They have something like a spray. They spray the vagina and then flush out the normal flora. When you do that, yeast can grow and you will have yeast infection. And then wearing wet or tight underwears can allow yeast to grow. It can create a kind of environment and then yeast will grow. High blood sugar. Yeast like sugar. They like sugar rich environments. So when you can link it to people that have diabetes. Yes, for people that have diabetes, they can have recurring yeast infection because yeast will definitely grow where there's sugar. And then there goes the question everyone asks. Is yeast infection sexually transmitted disease? No, it is not. Because even virgins have yeast infection. Though sexual activities can trigger yeast infection. Some sexual activities that can trigger yeast infection are number one, irritation from friction. You know what I mean? In, out, in. It can trigger yeast infection. Another thing is the sperm that is being released inside the lady's vagina is alkaline. It is not acidic, and our vagina is acidic. So when the sperm gets into the vagina, it can disrupt the pH of the vagina, and then it will encourage the growth of yeast infection, of yeast that can lead to yeast infection. Another thing is irritation from condom and lubricants. Whether you use water-based lubricant or not, some people, whether it is water-based or not water-based, it will still irritate them. Yes, and they will develop yeast infection. So it is not sexually transmitted, but sexual activity can trigger or worsen yeast infection. That leads us to what are the symptoms of yeast infection. Irritation, yes. Burning sensation around the vagina, yes. Sometimes swelling, yes, yes. The lips of the vagina can swell. And also discharge, white discharge that is not drawing. It's not drawing. When you hold it like it's just going to. And then smelling, yes, it's going to be very smelly. What are the treatments of yeast infection? Antifungi. It could be in form of tablets, in form of cream or suppository, like the one you will insert inside the vagina. But once you start having recurring yeast infection, please go to the hospital so that they can find out the cause and they can treat you properly. I hope this video helped you. Bye.